Come with me as we take a journey to Mammogram City. You like that jingle I just made? Well, today I am going to get a mammogram. So I'm not yet 40, but my oncologist wants me to get one. You know, we do a lot of cancer screenings. If you haven't, check out the colonoscopy video. That's a good one. So today is going to be the mammogram video, and we'll be hearing some facts about mammograms. And the whole point of this video is, if you're getting one, it's just not that scary, and I'll walk you through it. That way you know what to expect, and you can see the machine, and I'll give you some facts. So let's go inside and let's go get a mammogram, people. Let's go. Women starting from like age 40 to 45, like you can start getting them, and then from 45 to 54 you should get them every year, and then after that you can space them out a little bit. Ooh, I won't get you. Can I get your voice? Can you explain what this is?
Sure. So this is our mammogram machine. This is going to be 3D, so that just lets us scroll through the breast, and it's better for density.
And so the breasts go in here. I've never had one. As you can tell, I'm very young, right? So I'm assuming they go in here, and I've looked it up. Well, I'm actually a doctor too, but so you should follow me. But they get smushed in here, and I hear it's very uncomfortable.
It can be, kind of depending how people take it. Like, of course, it's not comfortable. So we're going to take around 4 pictures.
Okay.
The first one top to bottom, and the second one.
Oh yeah, I saw it on the breast map. There was like an image of like a left and then middle and then right. So 2 of the middle, I would assume, would make the 4th image.
Kind of. So what we're going to do is we're just going to take, the first one is kind of just straight on. The second one is kind of the middle, we call it like an oblique view.
Oblique, okay, I know that word. I know oblique.
And so we use compression. The reason we do it is because it pushes the density of your breast away.
Yeah.
The tighter we do it, the prettier the picture.
Okay, so the more the smush, the better the photo.
Exactly.
It hurts to be beautiful.
Yeah. Exactly.
Okay, and then is this like PSI, like pounds per square inch, like when you do your tire?
Yeah, so it's just telling you how much pressure is on your breast when you do the compression. It sounds scarier than what it is.
Okay, no, I'm tough.
Yeah.
Well, I'm tough. Okay, how many PSI are we going to try to get to today?
So we do it until skin is taut, but usually like until it's very tight.
We'll see how many PSI we can get to. All right, thank you. All right, hi, I'm back. That didn't hurt at all, and we got up to 18 PSI. Now, I can imagine that whether it hurts or not, or if it's uncomfortable, is really dependent on the person, and also dependent on where they are in their lives, because I think if I got that done before breastfeeding 2 kids, I'd have probably been like, ow, this hurts. But, you know, my breasts have been through a lot. So I was like, oh, whatever. So no, for me, it didn't hurt at all. But I can see how it could be like really uncomfortable. It was the most interesting part was like the machine actually flipped over to get a different angle, and I thought that was pretty cool. That was pretty fun. And she did say that because it was my first ever mammogram, that they don't have anything to compare it to, obviously. So if they do see something like abnormal, since they don't have anything to compare it to, like they'll probably be like, you know, you gotta come in and get an ultrasound or get another mammogram. And she was just warning me, because if that happens, she doesn't want me to freak out, which is like a big, I think, another obstacle. Like, people being scared that the procedure or the screening is gonna hurt, but also people just being scared of knowing what it finds is another issue. And I mentioned this here and there sometimes, but when I get bad news, like, you know, we found like a mass, or, you know, things that make you not sleep at night, it helps me, and this is really morbid, and maybe it won't help everybody, but it helps me to remember that, like, that might not be the thing that kills you. Like, so and I hope my story won't change if I do call and they're like, oh yeah, there's a lump in your breast. But when you think about it, like, okay, that thing is there, but maybe it'll be there for like 10 years before it does anything horrible, or they might be able to just remove it or do something about it. And you might die from like a bar fight or like a car accident on the way there, or like a meteorite or something. So that is just something that helps me whenever I'm waiting for news, or if I do get bad news and there was only so much the doctors can tell you, like, we found this thing, and they're not going to say you're going to die on like November 2nd in 2075. Like, there's a lot of uncertainty that comes with the testing and then getting results. They're never going to tell you, like, this is 100% how this is going to unfold. And I think a lot of times it's the uncertainty that makes people nervous to get these things done in the first place. So I just like to remember that, like, anything can happen, and having all your emotions invested in like this being the specific way that you go, it doesn't make sense, because you're not omniscient. It's like you don't know that is going to happen. Well, yeah, like, it sucks to get diagnosed with cancer, believe me, I know, but I'm still here, right? So if I would have gotten my cancer diagnosis and then immediately been like, okay, this is what's going to kill me, and then stopped living my life, like, I wouldn't have my 2 beautiful children and my mildly good looking husband. You have to keep living life. And I know, and I don't want to sound like, oh, if you have anxiety, like, it's all your fault for overthinking it. Like, no, that's not what I'm saying. But I'm saying, just be reminded that if you get bad news, that could be wrong too. Like, doctors are wrong. I see it. The bad news can be wrong, or it might not even be what kills you. It could be like, you go on an Everest expedition and you freeze to death. It's not fun to think about all these morbid things, but it's like, your demise could be something completely you're not even thinking of and unrelated. And that's not to say don't go out in the world and don't not climb mountains, and don't, you have to live your life. And so if you get the bad news, so if they call and they're like, hey, we found something, you have to come back in, I will try my best to just be like, well, I don't know what that something is. And so I'm gonna still, like, take my kids to dance class and still, and get busy and focus on other things. And hey, maybe I'll get in a car accident on the way to dance class, but you don't want to think too much about that. You just don't know, unless you're Miss Cleo. No, she call me now for your free psychic reading. People just don't know the future. And so that was just an interesting piece that she's like, yeah, they'll probably call you and want you to come back in, but don't freak out too much about it, because they don't have a comparison from before. So we'll see. I guess I should do a follow-up video about when I get a call and see if I'm like hyperventilating or throwing up, or how I react. Because I would hope I take my own advice about worrying about stuff, but we'll see. But all in all, the actual process was really smooth. I picked like a 7:30 in the morning one. I usually do that because I've worked on the other side, and I know that when you start, you're not backed up yet. And so I as a patient can get in and get out really quick if it's the first person in the morning. But having worked on the other side, I know if you come in around lunchtime, you might be sitting in that waiting room for a while. So the actual process itself, in, out, didn't hurt, might hurt for some people. The technician was very lovely. She did a very good job explaining everything, and I guess now we just wait, but we live our lives while we're waiting. That's the key part. Thank you guys for listening, and I hope this alleviates some mammogram or any imaging or screening anxiety you may have. And also, don't forget to check out the colonoscopy video, which was a little bit more unpleasant. You just watch it and see how it differs from a mammogram. Thanks.